Hi guys, we're here to talk about peripheral circulation. We've done the heart, we've done blood, and now we're going to look at vessels. And on our vessel-looking day, we're going to start out with a review of the heart. Hopefully after doing the heart lab and going through the whole lecture of the heart and doing it with our little diagrammatic, boxy, little cute hearts, our cute hearts. I'm going to attempt to do this entire lecture with an actual anatomically remotely accurate diagram. And the reason why I'm doing this is hopefully at this stage you've got the boxes in your brain. You can follow through where blood goes through the heart. And now we don't have to draw the heart in a diagrammatic way. Now we can actually apply what we know to a reasonably accurate diagram of the heart. So in this first little introduction, let's just review the heart. And then we're going to go through and we're going to feed blood to and from body parts. So we're going to do our upper limbs, we're going to do our brain, we're going to do our guts. We're going to do this whole thing just with the liver. It's pretty fantastic. So let's just review. Blue, what do you think this blue area is representing? Yeah, there's a whole lot of blue area, right? Shall we start in the right atrium? And who feeds into the right atrium? This would be the superior vena cava, and this guy is the inferior vena cava. These guys are vessels that are directly going into the heart. So what does that make them? They're great vessels. They're the great ones. So when we're reviewing the heart, our great vessels are basically everything else. Every other vessel that we're going to do is somehow going to feed into a great vessel or will have come from a great vessel. Our superior vena cava and our inferior vena cava both feed into the right atrium. Once in the right atrium, we pass into the right ventricle. And then where does blood go? This is the dirty blood from the body. So let's just make a little note. This is the body. And again, we could totally do our little boxes, the body box, but we don't have to because you already have the body box in your brain. Right ventricle, the blood goes up into what? Do you remember? It goes into the pulmonary trunk, and the pulmonary trunk branches into the left and the right pulmonary arteries. And these, we're good with this because we actually poked through these vessels when we studied the heart in lab. So these are pulmonary, what did I say? Pulmonary what's? What direction is blood going? Away from the heart. So they are pulmonary arteries. Really? The case of the mysterious disappearing letters? This is an interesting technological phenomena. Pulmonary arteries, they go to the lungs. We know that. That's a lung. We'll make it spongy and poofy. And then that's everything. That's everything blue. We have to bring blood back. There are more holes, and they're coming toward the heart. And in fact, they're coming from the lungs. Who are these guys? These are my pulmonary veins, and they're coming from the lungs back. And check it out. Here they are, two little openings coming from the, what side is that? Left side, the left lung, and entering into the left atrium. And this blood has been freshly oxygenated. Awesome. That blood is going to pass into the left ventricle. What is something about this heart that you notice that is not anatomically correct? Is there anything that you're looking at going, yeah, I'm calling BS on that thing? You know what? If I were just looking at this, I would be calling BS because, you know, maybe that's a fraction of a millimeter thicker on the left side, which is going to pump where? To the whole body. And so it needs to be much thicker than this. And you noticed that, I'm sure, when you did the lab and you palpated. I mean, once you identify left ventricle and right ventricle, the rest of the game is like piece of cake, because the difference between left and right is so ridiculously obvious. So left ventricle is thick and giant, and we're going to pass, the blood is going to pass through the left ventricle and into the ascending aorta and the aortic arch. So this piece right here is the ascending aorta. Oh, this isn't going to help because this is the aortic arch. Nice. I think that it's important to note that we actually have 3 vessels coming off of our aortic arch, and we're going to keep coming back. I'm going to shrink down the little heart. The important vessels are going to be the ones that are entering and exiting the heart. As far as the pulmonary stuff goes, I think next we're going to look specifically at the pulmonary circulation, but that's just going to be a review. Pretty straightforward, not a whole lot of stuff to look at there. But after that, we're going to shrink the heart down so that we can fit it in a page, and then we're going to draw all of our vessels in relation to that heart. And I think that will be kind of a handy little exercise to do. I think that I've done everything heart-related to review. Okay, so let's go ahead and do the pulmonary circulation and then move into the new stuff.